It is now time for our panel. Please welcome to the stage Dr. Georges C. Benjamin, Executive Director of the American Public Health Association, Lynn Albizo, Chief Public Policy Officer at the Immune Deficiency Foundation, and Imran Ahmed, Founder and CEO of the Center for Countering Digital Hate. Welcome all.
We're moving into Ravens territory right now, just in interest of full disclosure. I think we have 2 Ravens fans here. Doctor, you can sit right next to me.
You want me there?
Yeah, thank you. Thank you all for being with us. We appreciate it. Dr. Benjamin, let me begin with you. What have you learned? You were here for the full panel earlier, 2 members of the House, one former, one current. What's your takeaway? I
think there's an opportunity for collaboration if we can get them to get out in front of into a private room and away from the television cameras.
But can we do that?
We're going to have to, otherwise we're going to be in big trouble.
What do you think is the big public health debate moving forward as we see a new administration, a new HHS secretary, and a lot of questions looming?
Well, as we heard earlier, I think vaccines are really important. And just in general, all this misinformation that you're hearing. I represent the Immune Deficiency Foundation, and that's for individuals that have primary immunodeficiencies. Those are genetic disorders of the immune system, and they rely upon herd immunity, as you just heard. So they may not build the immunity that others do when they get vaccinated, but they need to have everybody around them vaccinated. And that's true for everyone who's immune compromised, including all the elderly people that we just heard about as well.
But as you know, herd immunity was really part of the looming debate with COVID. What are the lessons from that?
Well, we need to just work. The lessons are that people, we don't want to see the kind of deaths that occurred there. I think by a lot of misinformation that got out there, we need to have we need to be more, secure about what the information is out there that we have that is science-based, but we know that people don't really think about science. They care about how they feel. So it's important that we realize that somebody they know, somebody they care about is probably immune compromised. We know that there's 14 million people that are immune compromised that are under 65. So if we take that and we add all the people over 65, 58 million, we're talking about 1 in 5 people that are at risk when you don't get vaccinated. So it's really important that people kind of see how it affects their own family or the people around them. And I think that's easier to relate to than sending out a lot of information, which is great and we would like, but people don't always relate to science and data. So we have to bring it down to their level.
So let me bring your colleague in the debate, because you've gone head-to-head with Elon Musk. He is going to be on the west front of the Capitol along with Mark Zuckerberg, and there's a big debate on misinformation, disinformation. Specific question, does Congress have a role in trying to regulate some of this information, and what's the role of these social media platforms?
Well, what's the role of the social media platforms? Clearly, they are the primary vector for the disinformation that we're seeing, and the algorithms that decide what content gets shown on those platforms, what gets promoted and what gets demoted, they have absolute control over that mechanism. Think about it this way. Every day, 13 lifetimes worth of content is uploaded to TikTok. 13 lifetimes. So clearly you're not going to watch it all. Like, yes, anyone can post what they want, but not everyone's going to get seen. They decide what gets seen, right? A few years ago, Mark Zuckerberg put out a chart. Mark Zuckerberg is a very interesting character because he is also sort of a scientist, a mathematician. So he put out a chart which was on the x-axis how violative content is, so how likely it is to break the rules, and on the y-axis was engagement. And it shows that low violative, very low engagement, all the way to the absolute cusp of being violative, and then it shoots up. And that's because when someone says something stupid, we tend to react. When someone says something sensible, we tend to just go, oh, yeah, okay, sure, and do nothing, don't react to it. But because engagement drives amplification on these platforms, he understood that that meant there was a churning effect of the most bananas stuff into the center. The thing that becomes most visible is the most banana stuff. And he said that's why they need to have moderation. That was his argument for having active moderation. Mm-hmm. Now he says quite the opposite. And actually, you know, I'm British, so we have a very keen sense of irony and cynicism. We come from a very grey, rainy country. So, you know, I see a degree of cynicism in what we're talking about here. Now, look, that's the way that platforms work. Should government tell us what to say and think? Clearly not. I mean, people tell me, I'm married to an American, my children are American, I'm a permanent resident here, I've been here for many years. But people tell me that, you know, other countries don't have as much of a reverence for freedom of speech. You do know where John Locke came from, don't you? So we, of course, have a reverence for freedom of speech. We, of course, have a reverence for democracy. I don't think government should tell us what to say or do. I actually want a more informed discourse on how these platforms work. I want to be able to hold them accountable. If a physician told you to take something which caused your child to die, you would sue them. If a platform's algorithms repeatedly tell you something, and such that you believe it to be true, and that causes you significant harm, you should be able to sue them. But you can't. Because there's only one industry in America today that's been given a specific get-out-of-jail-free card by Congress. Section 230 of the Communications Decency Act 1996 means that you can't hold them liable. And so the system of checks and balances is broken down for social media companies. I don't think Elon Musk is an evil man. I don't think Mark Zuckerberg's an evil man. I just think they're doing what they're allowed to do. And we can change what they're allowed to do. We can create checks and balances on them. We can make them subject to the same negligence laws, the gross negligence laws, the knowing indifference laws that we have in place for other companies. And we can mandate transparency. So one of the things that we've been arguing for around the world, I'm going to the UK tomorrow, I think, to go and give evidence to Parliament. I'm going to Brussels shortly. Both of those jurisdictions have created transparency laws, so that we understand how the algorithms work, how the advertising work, how their content enforcement works. If you're going to take content down, tell us why. So those are things that Congress can do to have a more informed discourse without having to censor anyone.
And of course, nothing has changed since 1996 in technology when that law was put in place, so we can rest assured that it is still in place today, I say tongue-in-cheek. But that gets to my point with you as a public health expert, because you have really seen the trajectory of misinformation. Walk us through the changes you've seen over the last 30 to 40 years as a public health expert from, you know, the 80s and 90s to where we are in 2025.
Yeah, so in the early 90s, I was a health officer here in Washington, D.C., and you know, our immunization levels were very low, and we passed laws. We passed Vaccine for Children's program to make sure all kids had access to vaccines. And we were able to, you know, regulate and put in place rules that you couldn't go to school unless you got all your shots. And, you know, we didn't get a lot of pushback from that. We were very well below the radar screen. Fast forward to 9/11 and the anthrax letters, when we felt threatened by this powder. I mean, we were chasing powder all over the place. We were checking powdered donuts for what people were concerned that might be, you know, put them at risk. And people were checking their mail. But both sides of the political aisle were very comfortable having reporting laws, requiring people to do things, shutting down things. No big deal. Great consensus, pretty good leadership at the national level. Fast forward to COVID. We had a total breakdown in leadership at the national level in COVID, quite frankly. We did a wonderful job, as you heard earlier, of Operation Warp Speed. We did a good job on the science. We did a terrible job on the implementation. We did not educate the public. We just assumed people knew what a vaccine was. And we had people who gave disinformation, which of course then was magnified by misinformation. And I always ask when somebody gives disinformation, who benefits? Mm-hmm. And quite frankly, there seemed to be a political benefit to giving disinformation, which continues today.
Which has led to the challenges that you're facing with your organization, because trust in all institutions is now at an all-time low. How does that complicate what you're trying to do?
Well, very much so. I can give you an example beyond just the vaccine issue. We have always advocated for universal newborn screening. Individuals with PI, there's a condition called SCID, severe combined immune deficiency, which infants are born almost with no immune system. It's also been known as the boy in the bubble disease. We had advocated for 10 years to get all 50 states to screen for SCID, and now they do, which is great. But the Newborn Screening Saves Lives Act, which was year after year after year reauthorized, the last several years has been not reauthorized. That gives money to the states to do this newborn screening. It can allow all different kinds of conditions to screen for that. So things that used to be just normal, like, yes, everyone agrees, newborn screening helps us identify babies that could die or have serious disabilities, are now being challenged on the basis, people saying they should have the freedom to not get their child tested for these things, which, is really very, the cost benefit is very clear. And the same type of thing with vaccines. So things that the community as a whole have decided are important are now being questioned. And I think it's, the divisiveness in politics, the social media, all these things are contributing to that. And we just, I agree with Dr. Bouchon that we need to get back to normal. We need to work bipartisanly to, have more information that people can trust in all these areas, because public health is so important.
So I realize, again, going back to your challenges or battles with Elon Musk, how concerned should we be as a society?
For those that don't know about my battles with Elon Musk, we did a study of X when he took over the platform, just a data study to look at the prevalence of hate speech on there. So the most offensive term you can use about black people, the N-word. We looked at the prevalence of anti-LGBTQ plus language, anti-women language, anti-Jewish language. And we found that there was an enormous uptick. There was a 202% increase in use of the N-word on the platform after he took over. Because he said, you can say what you want. And really nasty people thought, well, we will. And that study was on the front page of the New York Times. He claims it led to $100 million of advertising being lost by his platform. And he sued us, not for defamation, not for being wrong, but for the act of doing research itself. He said it broke the terms of service of X to use X to study it rather than, to consume ads all day. And we beat him, of course, because we have a First Amendment right to study a platform and to tell people what we find. I think there's something there, that the courts remain a place where truth really matters, right? Mm-hmm. And that's a vital protection, and it will be a vital protection in years to come. One of the observations I'd make, and forgive me, I have to put on my glasses because I'm 46, I'm getting blind. So this is...
That's the new 30, by the way.
Yeah. It's one of my favorite press releases of all time. October the 22nd, 2020. So before the 2020 election. Press release, fact, Joe Biden's, this is from the Trump campaign, Joe Biden's anti-vaccine rhetoric is anti-science and dangerous to public health. And it lists out a number of times when Joe Biden suggests that the coronavirus vaccine won't be real and may not be safe. Biden says the vaccine is not likely to go through all the tests that needs to be and the trials that are needed to be done. Biden asks, who's going to take the shot? Are you going to be the first one to say, sign me up? Kamala Harris says, I think that's going to be an issue when asked if she would get an approved coronavirus vaccine. Biden says he would only take the vaccine if we know all of what went into it. So
this is pre-COVID.
This is during COVID. This is while COVID was going on. This is in October 2020, and these are all listed out. Now look, the point here is that vaccines aren't a partisan issue and weren't when we started studying it. When we were doing the research that became Disinformation Dozen, the paper that sort of got a lot of attention because it mentioned 12 of the leading anti-vaxxers who produced the content that comprised 2/3 of all content against vaccines shared on social media. Now that was a snapshot study that got a lot of attention at the time. Vaccines should not be a partisan political issue. The question of whether or not vaccines are the most effective, safe, and impactful medical innovation in the last 200 years is a matter of simple fact, not a football for politicians. And the point that I would make is, at this point, I think that we've got to stop having debates over, are people being partisan, who's doing the disinformation, is it Donald Trump or is it Joe Biden or is it Kamala Harris? We have to deal with the fact that getting away with all of this, sniggering in the background, profiting from all of this, are two primary actors. One is the social media platforms, and the second is an industry that has been set up to undermine public health in America and profit for themselves either politically or economically. And the people that we identified in the Disinformation Dozen study, they have taken countless American lives. I'm 46, so I'm that generation that 9/11 was the first terrible thing that happened in my life. It was the day before I turned 23. 2,996 people died on that day. I went to an army recruitment center the next year. I ended up going to Cambridge to study politics. I changed my life. I'd been studying medicine, and I went to work in Parliament for several years. In that moment, think about what we did in response to those 2,996 innocent souls taken. Mm-hmm. 311,000 people died in the pandemic unnecessarily because of disinformation, according to Microsoft AI and Brown School of Public Health. How on earth is it that we have not yet held accountable the people who were responsible for those deaths?
So let me jump in, Dr. Benjamin. Let's take the personalities out of this for just a moment, regardless of who is president, regardless of who was HHS secretary. But how much authority does a secretary have when it comes to vaccines and public health? And if there are policies being put in place that you may disagree with, what are the next steps?
Yeah, we have an enormous system of checks and balances to evaluate early therapeutics, to decide whether they're safe and effective, and to figure out who gets them. The problem with a secretary, and having had that job both at the city level and at the state level, is that they have an enormous bullhorn. Mm-hmm. People see them because of who they are as the nation's chief health strategist. They assume that they're going to give them authoritative, factual, and truthful information that won't hurt them, but that will improve their health. So people start with anything they say that they're believable. So they have an enormous bullhorn. So they can influence a lot. Now the federal government, public health is managed at the local level, at the state and local level. That's where the laws really are manifest. But the national government provides enormous steering of those guidelines. And they can influence a lot.
So what you're saying, and you can jump in on this, is because we've heard this so often, people seem to gravitate to those sources of information that reinforce their own point of view, and so that they will use that as an excuse or reason to do something or not do something.
Sure. I definitely think in terms of the bullhorn and the leaders in the federal government are the ones that have the influence. So people are going to look toward, now because we're so divided, people are going to look to what leaders are going to reinforce what they already think. So it's important. We've always in the past had the public health agencies, CDC, the FDA, all those were things that people trusted regardless of whether you were a Republican or a Democrat. But there's so much skepticism now in the federal government that people get, it gets very partisan all the time. And I think, we need to get back to the point where the agencies are trusted regardless of who is on the top. But it becomes very hard when you're appointing leaders that are known to be very divisive.
So based on that, Dr. Benjamin, what worries you the most? What keeps you up at night?
Yeah, what keeps me up at night is making sure that we can reestablish trust and that we get people, policy is people, or people are policy. And so we want to make sure that the people that are in these jobs, that are nominated for these jobs, are well-trained, have the proper administrative capacity, and have the judgment to do the jobs. And so I think that's the test of what any elected leader ought to use when they're picking people for those jobs.
For your organization and for the Alliance on Aging Research, what are your marching orders? What are your recommendations? What are you doing specifically?
Well, we've put out a statement on our website, and we also sent letters to the Senate committees just emphasizing the importance of vaccines, the importance of public health for the HHS secretary to embrace. I think we've seen in the news, we've seen the history of the appointees at this point where it makes you question whether or not they would support vaccines and public health. So we're making our voice heard. It's not about Republican or Democrat, but it's about supporting science, supporting public health, and protecting our communities. Because people who are, we represent, in addition to the Immune Deficiency Foundation, there's an Immunocompromised Collaborative, which is all different organizations that represent groups of people that are immunocompromised, like people with cancer, people with that need organ transplants, AIDS, lymphomas, and all kinds of autoimmune diseases, and all these different groups are very, are at risk. So we need to have leaders that are going to support basic public health and basic truth.
A good complication, Dr. Benjamin, to all of this is that we're living longer, we're living healthier, but also as we get older, that presents a whole new set of problems in this debate, doesn't it?
No, it absolutely does. And I think we've got to recognize that, we just had a president who died at the age of 100, and I'm trying to beat his record.
Good for you.
But the challenge we have is that as we get older, the spectrum of disease changes, so that our bodies fail differently. So we become more susceptible to a range of infectious diseases as our immune systems fail. We're on more medications, we get more chronic diseases. Those change our risk factor. And so we really need to begin thinking about health collectively across the lifespan much differently than we've thought about in the past.
And so let me conclude with all of your comments. There are just so many layers, and you outlined so eloquently the political and media challenges that we're facing in our society, and you outlined the health challenges. So let me just give each of you a moment to kind of give this audience, you heard the two members of Congress, your own takeaways and what you think the challenges are moving forward. We'll begin with you.
Trust is important, and I think we've got to figure out how do a better job of bringing people into the conversation. The good news is that we had, for the first time, a national conversation around health, which we used to have quietly in the back rooms or in private clinician rooms, and we need to figure out how to do that collectively and on a population basis going forward.
I agree with that. I also think, all the messaging out there we need to make sure that we get out messages that are positive about true public health issues. We need to battle a lot of the misinformation and get back to normal.
Can we do that? Can we get back to normal?
I hope so. I think that's really an important role that a lot of advocacy organizations have, to let our public officials know that it matters to us and that people who are immune compromised are at risk when we ignore the science. So we'll be working hard to get that message out there.
Well, thank you for the work that you're doing, and we will give our friend from the UK the final word.
Actually, from Washington, I live in Tacoma Park, so
That's a whole other country, but that's another story.
it's slightly eccentric. That's why I like it. Look, I'm an optimist. I worried that you were going to ask me what keeps you up at night, because nothing really keeps me up at night. But we're going to have to judge ourselves on what we do, rather than how much we talk and discuss. Lives have been lost. We know what the problem is. Question is, what are we going to do about it? And each of us can play a part in that, whether it is urging our representatives to take action on transparency and accountability, whether it is bolstering our public health advocates by going out there and spreading good information ourselves. But I think that this is a collective endeavor that we're going to have to do. And I am a great believer in America. I love this country. And I know that whatever challenges are put up against it, and I don't think we can go back to the status quo ante, because I think we have fundamentally changed the way that we communicate in our societies. But I know America will be the first place in the world to work out how we can get past that to a better future.
So you are leaving us with a much more optimistic tone. You're optimistic?
Like I say, I'm an optimist.
We will leave it there. Thank you all very, very much. Go Bills. I'm just kidding.